In this video, we will discuss about the thoracolumbar fascia. It is also known as lumbar fascia. Now, first of all, definition. Definition of thoracolumbar fascia is that it is a fascia that covers the deep muscles of the back. Then after that, next question is that where the thoracolumbar fascia lies. Now here you can see this one is the transverse section of the abdominal cavity, and here you can see this one is the posterior abdominal wall. And always remember that this thoracolumbar fascia lies in the posterior abdominal wall. Now here you can see these are the different layers of thoracolumbar fascia. And first of all, you will identify the vertebra, that is the lumbar vertebra. And here you can see these are the paravertebral muscles. These muscles are the psoas major muscle, and then this one is the quadratus lumborum, and these are the erector spinae muscle. Now thoracolumbar fascia, when we see horizontally or in transverse section, you can see thoracolumbar fascia is consist of three layers. Now this one is the anterior layer of thoracolumbar fascia that lies anterior to quadratus lumborum. Then here you can see this one is the middle layer of thoracolumbar fascia that lies posterior to quadratus lumborum. Then here you can see this one is the posterior layer of thoracolumbar fascia that lies posterior to this erector spinae muscle. So these medially thoracolumbar fascia is attached to the transverse process and spine of the vertebra, and laterally you can see it's split into three lamina. These are the anterior lamina, middle lamina, and posterior lamina. Now on the lateral border of this quadratus lumborum, these lamina, especially anterior and middle one, they unite together, and here this margin is formed, and from this margin there is origin of anterolateral abdominal wall muscles, and this one is the transversus abdominis, and this one is the internal oblique muscle. So it was a brief introduction of the layers. Then after that, made up of it consists of thoracolumbar fascia made up of three layers, that are the anterior, middle, and posterior. Anterior, middle, and posterior layer. Then after that, extent of the thoracolumbar fascia. Now we will see the layers. Anterior and middle layer, they are confined to lumbar region, and when we will see the posterior layer, this posterior layer extends upwards into the thoracic region, and due to that reason this lumbar fascia is known as thoracolumbar fascia, and this posterior layer also extends downward in the sacral region also. Then after that we will see the attachment of each layer one by one. First of all, we will discuss about the anterior layer. Now here you can see these are the muscles of posterior abdominal wall. Here you can see this one is the psoas major muscle, quadratus lumborum, and iliacus. Now here you can see this one is the quadratus lumborum, and this one is the anterior surface of quadratus lumborum. Now this anterior surface is covered by the anterior layer of thoracolumbar fascia. Now here you can see superiorly this thoracolumbar fascia, it thickened between the transverse process of L1 vertebra and tip of 12th rib, and here it makes the lateral arcuate ligament. So always remember that lateral arcuate ligament, it is the modification of anterior layer of thoracolumbar fascia superiorly, and just below it is the quadratus lumborum muscle. Then inferiorly, here you can see this one is the iliac crest. Now inferiorly, this thoracolumbar fascia is attached to the inner lip of iliac crest. Then after that, for medial and lateral attachment, you will see that this one is the transverse section, and here you can see this one is the lumbar vertebra, and this one is the psoas major muscle, quadratus lumborum, and erector spinae. Now as you know that anterior layer lies anterior to the quadratus lumborum, just like this, and medially it is attached to the anterior or vertical ridge on the anterior surface of the transverse process of lumbar vertebra, and laterally here on the lateral border of quadratus lumborum, it will merge with the middle layer of thoracolumbar fascia. Then after that we will discuss about the middle layer of thoracolumbar fascia. Now this one is the cut part of quadratus lumborum. Now posterior surface of this quadratus lumborum is covered by the middle layer of thoracolumbar fascia. Now superiorly here this fascia, it is attached to lower border of the 12th rib, and inferiorly here you can see this one is the ilia crest, and it will be attached on the intermediate lip of ilia crest. Then after that for medial and lateral attachment, you will see here that as you know that this one is the quadratus lumborum muscle, and middle layer lies posterior to the quadratus lumborum. So now here you can see this one is the middle layer. Now medially this middle layer is attached to tip of transverse process of lumbar vertebra, while laterally on the lateral border of quadratus lumborum these will blend with the anterior layer of the thoracolumbar fascia, and here it makes a margin, and from where there is origin of transversus abdominis and internal oblique muscle of the anterolateral abdominal wall. Then after that we will discuss about the posterior layer. Now here you can see this diamond shape is the posterior layer of thoracolumbar fascia. Now this posterior layer upward it will extend into the thoracic region. This one is the thoracic region, and due to this reason this fascia is known as thoracolumbar fascia. Now in thoracic region it lies deep to the this one is the trapezius and rhomboids and serratus posterior superior, and medially it is attached to the spine. These are the spines of the thoracic vertebra, while laterally it will be attached to the angle of ribs, while this one is the lumbar part, and then in the sacral region this will extend into the sacral region, and here it will be attached on the outer lip of the ilia crest. Then after that we will discuss about the attachment of posterior layer in the lumbar region. Now superiorly it become continuous with the thoracic region, then inferiorly it become continuous in the sacral region, and it will be attached to outer lip of ilia crest. Then again for medial and for lateral attachment we will see this figure. Here you can see this one is the erector spinae muscle. Now posterior layer medially is attached to the spine of lumbar vertebra, while laterally it will merge with the middle layer of thoracolumbar fascia. So this was the medial attachment and this was the lateral attachment. So in this way you can see that quadratus lumborum is enclosed between the anterior and middle layer of thoracolumbar fascia, while erector spinae muscle is posteriorly it is covered by this posterior layer of thoracolumbar fascia. Now always remember one thing, that this psoas major muscle is covered by another fascia, and that is psoas fascia, that is medially attached to the body and intervertebral disc of the lumbar vertebra, and laterally it will merge with the or blend with the anterior layer of the thoracolumbar fascia. Now at the end you can see these layers in table form. Now here you can see this one is anterior layer, middle layer and posterior layer, and as you know that all the layers have 4 attachments. Now first of all anterior layer. Now superiorly it becomes thickened and makes the lateral arcuate ligament. Inferiorly it is attached to the inner lip of ilia crest. Medially here you can see this one is the anterior layer, and medially it is attached to the vertical ridge on the anterior surface of the transverse process of lumbar vertebra, and here you can see this one is the transverse process, and this one is the anterior surface of the transverse process, and this one is the posterior surface of the transverse process. And laterally here you can see it blends laterally with the middle layer. Then middle layer superiorly it is attached to the lower border of 12th rib. Inferiorly it is attached to intermediate lip of ilia crest, while medially, now here you can see this one is the middle layer, and medially it is attached to tip of transverse process of lumbar vertebra, and laterally it blends with the anterior layer. This one is the anterior layer, and laterally it blends with the anterior layer at the lateral border of quadratus lumborum. Then posterior layer, Now superiorly it becomes continuous on the back of the thorax. Then inferiorly it is attached to the outer lip of iliac crest, and then medially. Now here you can see this one is the posterior layer, and it lies behind the erector spinae muscle, and medially it is attached to the spine of lumbar vertebra, and laterally here it blends with the middle layer. So in this way you can see this one is the anterior layer, middle layer, and posterior layer. Now always remember that anterior and middle layer they enclose the quadratus lumborum, and erector spinae muscle posteriorly it is enclosed by the posterior layer. Now at the end always remember that these three layers lie from anterior to posterior as anterior, middle, and posterior. When they are attached inferiorly on iliac crest, so anterior layer is attached to the inner lip, middle layer is attached to the intermediate lip, and posterior layer is attached on the outer lip of iliac crest. So it was all about the thoracolumbar fascia.